I have never ridden in the cockpit of a plane, or on the back of a moto through the jungle. I guess I had never met with a minister of health either. But these were things that were not impossible for me to imagine. Then I went to the Democratic Republic of Congo, where I worked under the guidance of my advisor, Dr. Anne Ramoyne. After 7 months living in a country that seems to move backwards rather than forward, we had the opportunity to visit the east of the country. After hours on an 8-person charter plane, we landed in Ankoro in the Katanga province. We met with local authorities and huddled around hand-drawn maps taped to the wall. We discussed the different axes and modes of transportation we would need for each. They started with the closest locations, the normal and easy places to reach. Not exactly a picture of what's happening throughout the country. Finally, Nkondo was chosen, a village with no electricity, no means of outside communication, and a full day of travel to reach. A bit more difficult, but much more realistic. The journey required 3 hours by vehicle, 2 hours waiting at the first river crossing, using 2 roped-together pirogues to carry the motos with us. 2 hours riding on the moto, 2 more hours at a second river crossing. We were forced to leave our motos and use a smaller, and notably less stable pirogue. There were 14 of us, so we went one by one. And finally 3 hours on a 4-kilometer walk, which turned into 12 kilometers of marshes, thunderstorms, and eventually complete darkness. The health center staff welcomed us, and we spent hours drying off over a fire, listening to stories of the old health system and how it's changed over the past 20 years. The next morning, meeting with local health workers, we learned about their present health system. They know they're supposed to vaccinate regularly. They know it's supposed to be kept cold. They know they're supposed to report diseases regularly. They know so much, but they have so little. Staff isn't regularly paid, and paper is considered a luxury. Without the most basic resources, they do the best they can. Returning to Kinshasa, our journey didn't seem so extraordinary. But what I learned and what I saw, well, that's a different story.